Hi, I am Dr. Shudipto Bhattacharya, Senior Consultant and Head of Department of Cardiothoracic and Vascular Surgery at Jayaprakash Hospital and Research Center, Rourkela, Odisha. Today we are going to discuss on a burning topic, on a silent killer that has been raging over decades, that is valvular heart disease. Now, what exactly is valvular heart disease? The heart, as we know, has several valves which separates the chambers of the heart. In the right side we have the pulmonary valve and the tricuspid valve, and on the left we have the mitral valve and the aortic valve. Now these valves, when they get affected by disease, they lead to valvular heart disease, and that is a disease burden which is significant, which is a matter of concern. Why? Because it leads to more than 34,000 deaths worldwide, and this is the data from 2019. The incidence of valvular heart disease has been increasing. If we consider the 2019 data, 40.5 million of the world's population were suffering from valvular heart disease. If you consider India, rheumatic valvular heart disease is very common, and in fact about 4.5 to 5 per thousand population in India were found to be suffering from rheumatic aortic stenosis alone. So that itself gives you an idea about the burden of disease. Females are more commonly affected than males, and it has been observed that left-sided heart valves, namely the mitral valve and the aortic valve, are more commonly affected than the right-sided heart valves. There are various causes of valvular heart disease. In a country like ours, in India, the most common cause of valvular heart disease is rheumatic heart disease, which we know is more in the rural population than in the urban population. It is a disease of the poor, it is due to overcrowding, and as we know, it has been on the rise. The other causes of valvular heart disease include degenerative valvular heart disease. What is that? Because as life expectancy is on the rise, as the population is aging over time, more and more people are having age-related changes throughout the body, including the heart. And this age-related degenerative changes, age-related calcification affects the heart valves as well. That is actually the most common cause of valvular heart disease in the West, that is degenerative heart disease, degenerative heart valve disease. The other causes include congenital heart disease, which may also affect the heart valves, including the mitral valve, the tricuspid valve, the pulmonary valve, as well as the aortic valve. There may be trauma leading to valvular heart disease. Also, rarely it has been found that certain autoimmune disorders like lupus, like rheumatoid arthritis, they also may lead to valvular heart disease. So these overall are the common causes of valvular heart disease worldwide.
Signs and symptoms.
So how do you know that you have valvular heart disease? When to approach the physician? When to approach the cardiothoracic surgeon? Usually valvular heart disease presents as breathlessness. It may present as palpitation because of arrhythmia, that is disturbed electrical rhythm of the heart. The heartbeats tend to become irregular. Or it may present in the early stage as rheumatic fever, which in fact leads to rheumatic heart valve disease. So rheumatic fever mainly presents in the young, rheumatic valve disease presents in the young, and gradually these valves deteriorate over time, and the symptoms include pain in the chest, breathlessness, palpitation, etc. There may be night sweats. Patients often complain of sitting through the night, and finding it difficult to breathe. They cannot lay down on bed and breathe properly. There may be hoarseness of voice. These are the common symptoms of valvular heart disease. Apart from this, if it is a congenital heart disease, there may be bluish discoloration as in kids, as in tetralogy of Fallot, or other causes including difficulty in breastfeeding. Kids who are finding it difficult to breastfeed, kids who are finding it difficult to grow, body weight is below normal, they should definitely undergo a screening for heart disease, valvular heart disease as well as congenital heart disease. The management of valvular heart disease is multidimensional. It begins with medications, it begins with lifestyle modifications. When the disease presents itself, when it is in the mild stage, when it is in the early stages, but when it becomes severe, then the only form of management is intervention. Whether it is in the form of heart valve repair or valvotomy or heart valve replacement. Now these valves may undergo several changes. What are those changes? Either there may be stenosis, where the valve orifice area, the opening of the valve becomes smaller. So this is called stenosis of the valve. This occurs with time. Second mode of disease affecting the heart valves is regurgitation. What exactly is regurgitation? It means the valve is leaking. Valve is leaking blood in the opposite direction, leading to dilatation or increase in dimensions in the heart chambers. Third is prolapse, where the heart valve itself, the leaflets of the valve itself are not opening and closing properly. So that is heart valve prolapse. So in all these cases, the disease has spread to the valves and it needs some sort of intervention. Whether it is an intervention, whether it is a surgery. Surgery comprises of heart valve repair and replacement. Heart valve repair when? Suppose it is a case of myxomatous mitral valve disease, or there is a particular leaflet that is prolapsing which can be repaired. Then there is the scope of repair. That repair is done surgically. It is an open heart procedure, and that repair may also include putting in a ring around the mitral valve. Also, right-sided valves may need repair, like the tricuspid valve, which may be functional, but if the size of the valve increases beyond the limit of around 40 in size, 40 millimeter, then it may need repair or replacement, depends on the pathology affecting this valve. So these are the modes of surgery. The most advanced mode of surgery is obviously transcatheter valve replacement. As we know, for patients who are very old, for whom surgery is very risky, transcatheter aortic valve replacement, that is TAVI, is done, but it has its costs. The cost burden is huge in a country like ours. Apart from that, we have the normal heart valve replacements, whether it is the aortic valve replacement, the mitral valve replacement, tricuspid, and there are various options available in the market from which the patient chooses. Also, it depends upon the age of the patient and other factors on which valve will be good for this patient is based on. The risks involved. is very important in valvular heart disease. If the patient does not undergo surgery or does not take the medications as advised to him or her by the physician, then the valve will gradually deteriorate over time. It may lead to death, and as I said in the beginning, more than 34,000 deaths have been reported worldwide as data from 2019 itself from heart valve disease. So risk of death is very high, especially in the young, if it is left uncatered for and no surgery is done. Now the question of risks of surgery. Any surgery, as we know, has its associated risks, but over time these risks have come down. Nowadays the risk worldwide for any heart valve replacement or heart valve repair is around 2 to 4%. There may be associated morbidities depending on the present clinical status of the patient. Depends what is the heart function of the patient, associated comorbidities like whether the patient is having chronic kidney disease, whether he or she is having uncontrolled diabetes, etc. So all these factors govern the risks involved. But 98 to 96 patients out of 100 go home without an issue and do well in life after a heart valve surgery. So if you are having a valve related condition in your heart which is curable, please consult your cardiothoracic surgeon immediately, because after that you can lead a normal life and the quality of life will be very good for the rest of your life. Yes, now comes to what valves are put in the heart. There are various artificial heart valves available in the market, both Indian made and made abroad. Broadly they are classified into mechanical heart valves and biological heart valves or tissue valves. Now who needs mechanical heart valves? The younger population needs mechanical heart valves, whereas the elderly need the bioprosthetic or tissue valves. I'll come to that. A population whose age is less than 60 years or less than 65 years, they are better off with mechanical heart valves or metallic heart valves. Whereas a population that is aging, that is more than 60 years of age, more than 65 years of age, it is better off to put in the biological valve or the tissue valve. Now why is that? The problem lies in the metabolism in the young and the old. As we know, in the young the metabolic rate is very high. So since the metabolic rate is very high, and if it is a biological valve or a tissue valve, that valve is usually made up of porcine or bovine pericardium, and the degeneration rate of these valves in the young with a high metabolic rate is very high. So this patient, once implanted with a biological valve or a tissue valve at a young age, will need a redo surgery very early in life. Maybe in 5 years, maybe in 6 years, that valve will degenerate and he will need a redo surgery. So that is risky. Say a patient is just 25 years old, how many redo surgeries do you want him to have with a biological tissue valve? So that is the biggest problem with biological tissue valves, is rate of degeneration is very high in the young. So that is why metallic tissue valves or mechanical valves are preferred in the young, whereas tissue valves or bioprosthetic valves are preferred in the elderly. Now what is PT-INR? PT-INR is prothrombin time international normalized ratio. Now what is prothrombin time, you would ask? It is the time taken for the blood to clot. And why do we need a standardization of the same? We do need a standardization so that it is the same, the result obtained is the same across standardized laboratories across the country and across the globe. So that's what makes it very, very important, especially after a heart valve replacement. More so in the mechanical heart valves, I'll come to that. For biological valves or tissue valves, you just need 3 months of anticoagulation or 3 months of blood thinners. Why do you need these blood thinners? Because an artificial heart valve has been implanted in the body and you want to curtail the risk of thromboembolism. The risk of blood clots arising in the heart is big, and that needs to be curtailed by using these blood thinners. And why is PT-INR done? PT-INR is done so that a standard is maintained. The normal PT-INR, if you ask me, is around 0.9 to 1.1. But in patients who have undergone heart valve replacement, it is usually maintained between 2 to 3 or 2.5 to 3.5 depending on the valve implanted. For tissue valves, however, that is the biological valves, PT-INR needs to be done just for 3 months, because for biological valves you need to put them on blood thinners for 3 months. After that the valves endothelize and the patients need not undergo repeated PT-INR testing, and they need not be on blood thinners after 3 months. But for mechanical valves, blood thinners have to continue for a lifetime. And PT-INR needs to be checked at regular intervals depending upon the advice of the surgeon, and it needs to be maintained at a specific limit. Because if INR is all of a sudden high, say INR is 7, INR is 10, you need to stop your blood thinner immediately and consult your doctor, report to the hospital emergency. Because too high an INR increases the risk of bleeding. Again, if the INR is very less, say the INR is 0.7 or 0.9 or 1, then it increases the risk of blood clots forming in the heart. So again, the maintenance of INR in a particular range is very, very important, especially for those who have undergone mechanical heart valve replacement. As I said, it is more important in the young than in the elderly who are undergoing biological valves or tissue valves who need blood thinners, but they need blood thinners for 3 months or so. So that is the basic difference between mechanical heart valves and biological valves or tissue valves. The results of surgery are very good, at least in our institute, in our hands. So far so good. By the blessings of Lord Jagannath, so far we have had 100% success in all heart valve replacements in our center, and we would like to continue delivering such results in the long run. Next, the question comes, I need a heart valve replacement. So, for how long do I need admission in a hospital? When can I go home? When can I join work? If you are admitted for heart valve replacements, obviously you will undergo some basic tests, including maybe a 2-dimensional echocardiography. You will undergo a dental checkup to check if there is any source of infection, because that's something which a surgeon wants to rule out, which may spread to the heart. Some basic blood tests, and then you can get admitted for the heart valve surgery. Once surgery is done and your INR is settled, it is in the target range, then you are discharged. Usually what we do is, our protocol is, we discharge our patients within 3 to 4 days of surgery. And the patients are fully mobilized, they walk around in the ward, they can walk around at home, and it is at that stage that we discharge all our patients. When can you join work? Well, if you are working light, meaning you are working on your computer or your working is writing and it is light work, you can join work at the earliest. Only thing, if a sternotomy is done, that is the middle bone in the chest, that is the sternum, is entered, then it is advisable to restrict heavy work for 2.5 to 3 months. Heavy work includes lifting heavy weight, putting stress on your chest. That has to be, curtailed for the initial 2.5 to 3 months. After that, you can even do heavy work, like those who are going back to physical labor. They are most welcome to do that. And for light work, as soon as you are discharged from hospital, that is 3 to 4 days time, you can go back to work immediately. The follow-ups are usually done by us. Usually the first follow-up is early, say around 7 to 10 days. Next follow-up is around a month or so after that. Then after 3 months, then after 1 year. And then just if it is a mechanical valve, maybe over telecommunication, you just keep in touch with us regarding your INR values, so that we also know, we are also certain that it is within the target range. So that's all. I hope I've answered the frequently asked questions on valvular heart disease, and hopefully all of you found it useful. Thank you.